Workers are overwhelmed with the stress of infection. But there is a more potent killer out there. Something no vaccine can protect you from. No mask can save you from. Heart disease. In order to spread awareness and hope, a team of specialists from across the world have come together to create the first and largest cardiovascular awareness program. On World Heart Day 2020, the 29th of September, the Heart Valve Center, India, led by a team of specialists from Chennai, brings you the TAVR World Tour. Watch 20 experts in 20 medical centers around the world perform TAVR procedures live in synchrony. TAVR, or transcatheter aortic valve replacement, is an alternative to conventional open heart surgery. These advanced life-saving procedures reduce recovery time to just 2 days in most cases and are relatively safer to be performed even during the pandemic. Pledge your support towards saving lives and join the record-making live event. One team, one heart. TAVR World Tour.
All right, salam, namaste, vanakkam, and a very good evening, ladies and gentlemen. I'm Samina. I'm going to be your host for today, and it's my absolute pleasure and honor to welcome you all on this glorious day. Ladies and gentlemen, a warm welcome to our guests from media and press, our fellow medical practitioners, and everyone else who's tuning in live to watch us and to also celebrate World Heart Day with us. Ladies and gentlemen, welcome to the TAVR World Tour, an initiative by Dr. A.B. Gopalamurugan of the Heart Valve Center and unit of HeartTeam India in association with the Kauvery hospitals and GeoMeet. Ladies and gentlemen, before we begin, I'd just like to quickly request everyone to kindly be seated. We have a lot of y'all still just standing around. Big great. If you can just grab a seat, settle down. And also keep in mind that we are living amongst a raging pandemic, so please keep your masks on throughout the entire event. Can I request all our guests to kindly keep your masks on, please? It's a humble request. So, ladies and gentlemen, what is the TAVR World Tour? While the world is at war with COVID-19 pandemic that has claimed millions of lives, heart disease still remains the #1 cause of death globally. At a time where patients and doctors alike are gripped by the fear of contracting corona, 20 medical teams from across the world have come together to create medical history. 20 medical teams, 20 medical centers from 20 different parts of the world perform 20 TAVR procedures to create awareness and fight heart disease and bring us hope. And on that note, ladies and gentlemen, we would like to take a moment to introduce the army of doctors that are going to be a part of the TAVR World Tour.
Hi, I'm Dr. Rahul Sharma from Stanford Hospital in the United States, and I'm part of the TAVR World Tour.
I am Dr. Eberhard Grube from the Heart Center in Bonn, Germany. I am part of the TAVR World Tour.
Hello, I am Dr. Natawut Pongpaparat.
Hi, I'm Dr. Naratip Shunhamaniwat
From Faculty of Medicine, Sirat Hospital, Bangkok, Thailand. We are
part of TAVR World Tour.
Hello, I am Dr. Alain Cribier from the University Hospital of Rouen, France. I am glad to be part of the TAVR World Tour.
Hi, I'm Dr. Vijay Iyer from the Gates Vascular Institute in Buffalo, New York, United States, and I am part of the TAVR World Tour.
Here's Fontos from the National Cardiovascular Center in Budapest, Hungary, and I'm part of the TAVR World Tour.
I'm Dr. Wang Jian. I'm from Cardiology Department's second affiliated hospital to Zhejiang University School of Medicine. I'm part of the TAVR World Tour.
I'm Dr. Xianbao Liu from second affiliated hospital, Zhejiang University. I'm part of TAVR World Tour.
Hello, my name is Dr. Andrew Wiper.
Dr. David Roberts.
Dr. Ranjit Small.
And we are the TAVI team from the Lancashire Cardiac Centre Blackpool and are part of the TAVI World Tour.
I'm Professor Lars Sondergaard from Copenhagen in Denmark. I'm very pleased to be part of this TAVI World Tour.
Hi, I'm Dr. Diego Gaia from the Santa Catarina Hospital, São Paulo, Brazil.
I'm part of the TAVR World Tour.
I'm Dr. Tito Kabir from the Royal Brompton Harefield Hospitals. I'm part of the TAVR World Tour.
Hi, my name is Dr. Abdurrahman Al-Nabti from Doha, Qatar, Heart Hospital, part of Hamad Medical Corporation. It's my pleasure to be part of the TAVR World Tour.
Hello, I'm Jonathan Hill from the Royal Brompton Hospital in London. I'm delighted to be taking part in the TAVR World Tour.
I'm Dr. Rahim from Prince Sultan Cardiac Center, Qasim, Saudi Arabia. I'm glad to be the part of the World TAVR Tour.
I am Dr. Khalid Amber from Heart Center in Najaf, Iraq. I'm part of TAVR World Tour.
I am Dr. Mohammed Al-Hajji from the Heart Hospital at Hamad Medical Corporation in Doha, Qatar. It's my pleasure to participate in the TAVR World Tour.
Hello, I am Dr. Prashant Vaijanath from the Kauvery Medical Center and Hospital, Coimbatore, India. I am a part of TAVR World Tour.
I am Dr. Anantharaman. I am Senior Consultant Cardiologist at Kauvery Hospital.
I am Dr. Karthik, Consultant Cardiac Anesthesiologist.
Hi, I'm Dr. Gopala Murugan from the Heart Valve Center, India, and I'm taking part in the TAVR World Tour.
One team, one heart.
Well, ladies and gentlemen, to all those who are just tuning in, this is the TAVR World Tour. As you can see, we are being joined by 20 medical teams from 20 different centers across the globe, creating medical history and also bringing to light how heart disease still is the #1 reason behind death. Now, ladies and gentlemen, we have with us 20 amazing teams who are going to be a part of the TAVR World Tour. So I'm going to quickly introduce Dr. A.B. Gopalamurugan of HeartTeam India, the mastermind behind TAVR World Tour, who is live with us and is going to be taking us through a TAVR procedure. He is the only participating doctor along with his team, representing India from the only Indian center, Kauvery Hospitals. On to you, Dr. Gopalamurugan.
Hello and welcome to TAVR World Tour. I'm Dr. Gopalamurugan. All this couldn't have been possible without my team because
I don't think we can hear him. Can we just increase the volume so we can hear him better, please?
I have to my left is Dr. Prashant Vaijanath, who introduced TAVR to India back in 2010. I have to his left Dr. Anantharaman, who's my colleague, TAVR specialist. To his left is Dr. Karthik, who's our chief cardiac anesthetist. And to my right is Dr. Abu, who's my wingman for all the TAVR procedures we've done so far. So without taking much time, we'll just move on to the centers while I let Dr. Anantharaman get on with the case. Let's move to Budapest, Hungary, and let's speak to the operators there, Geza Fontos, Peter Andreka. Let's get Geza. Geza, can you hear me? Hi, Geza. I think we can see you. So we have Geza Fontes and Peter Andreka at Hungary, Budapest, from the Göttingen Cardiovascular Center. Thank you, Geza. To say about Geza, I think Geza has been my good friend and has probably been involved from the longest period with TAVR in India. We're very grateful to Geza and Peter Andreka. Do you want to show us about your valve, Geza, and tell us what you're doing? Tell us a few words about your patient.
तीन नंबर पे वो दिया नहीं वो यार ये नहीं खुला ना कैसे जाएगा ऑडियो इनका 6 नंबर ये ना आपने 6 नंबर ऑडियो नहीं खुला ना कैसे जाएगा ऑडियो
Check. Now, ladies and gentlemen, I'd just like to take a minute while they fix this small little technical glitch that we're experiencing, that these are all doctors for the first time ever. They've all come together. And I think this is the first time something like this is being attempted world over. So, of course, we have our own little issues. We're trying to sort them out. It's also the first time we're exploring a platform like this.
Who's next?
So, requesting all of you all to be patient with us.
They can't wait for the deployment.
Okay, let's move to Denmark. Let me go live. Let's move to Denmark, Sondergaard, while you fix Hungary. Denmark is ready. Let's move to Denmark, Copenhagen. So from Denmark, we have Lars Sondergaard and Dr. Ole de Backer. Can we get Copenhagen lab on the screen? Ujjwal?
Yes, sir. Denmark is live.
Lars, can you hear us? Lars, we can see you. We can see Lars Sondergaard and Ole de Backer. Please go ahead, Lars.
Upper crown is open. Stabilizing arch is open.
Okay, I will bind you, and then we'll deploy.
We have to push more.
Next is
Now we push a bit deeper. We should come 2-3 millimeters low.
Yep.
Now the valve is placed.
So we can see here
Valve is released.
Mr. Lars Sondergaard has deployed a valve. Lars, if you can hear us, do you want to say a few words about your patient and what valve you've used?
Yeah, this is a valve from Boston Scientific, the Accurate valve. It's a self-expanding technology with superimposition of the leaflet. What's unique about this specific valve here is it's a next generation Accurate Neo 2. So it got an external sealing skirt, which should reduce the pacemaker. And at the same time, this valve also have a low rate of conduction abnormality.
Great. I think that's a fantastic demonstration. We can see the valve here. You've already done it, and it looks fantastic.
Yeah, it's a very easy self-expanding valve to deploy. It's just 2 steps, so there's very little manipulation during the procedure.
Amazing, amazing. Great demonstration, Lars, of nice, accurate deployment. Fantastic. Lars, we'll let you get on with your procedure. I'm going to move to Germany. I'm going to come back to you. Please stay there with me, Lars.
Sure.
Let's move to Germany, Eberhard Grube. So we have Eberhard Grube my good old friend and George Rickening. Can we get Germany on the screen, please? Eberhard and George, you there? Yes, Eberhard, I can see you with the colorful glasses. You look pretty. Hi there. So please let us know a few clinical bits about your patient, and we'll let you get on with your valve deployment, Eberhard. Ujjwal?
Next is Hungary, sir. Next is Hungary.
But we have not finished Eberhard. Born.
So right now it's Germany, then it's Hungary.
Yeah, but you're not showing Eberhard the Germany full screen. We have a partition screen which we don't want. Can you show Eberhard and connect his audio to me?
Yeah.
Hi, Eberhard. We are ready. Go ahead. Please tell us a bit about your patient. It's lovely to see you, by the way.
Okay, so it's a 79-year-old patient with coronary artery disease. He had cabbage in his history. He's a medium risk patient with some renal insufficiency, nothing specific, and he's now severe aortic stenosis, and he'll receive a TAVR, hopefully successfully in a few seconds. I hope you can also see our fluoro screen. We'll have already the Edwards in place. You can see the pigtail catheter in the left cusp. We'll have to replace it. Sebastian, he's on my right side. We will pull back the pusher.
We can see your valve beautifully going and crossing the valve.
Good. Valves in place. Okay, now rapid pacing, please. Rapid pacing. Yeah, okay, KM. Now we're going to implant the valve. It's a small anatomy. We choose a 26 valve, not too much. 23 was a diameter, but it was a large guy, and therefore we choose to use a larger device here. So
we can see the lovely deployment of the valve going nicely. Fantastic.
Yeah. And hemodynamic is stable, it's back again. So maybe Eva, you can take over. Yep. So that was a deployment of S3.
Great. Looks fantastic
there, we will do a contrast. And again, thank you very much, Gopi. Greetings to Chennai for having us as being part of the TAVR World Tour. And we wish you good luck. The message is a beautiful one. Hopefully the other centers will be successful too. And we will say goodbye with the team here together. Good luck and all the best to everyone.
Eberhard, don't go. Although you finished the valve in 10 seconds, please wait. We're going to come back to you for your message. I'm going to move on to Hungary. I'll come back. Let's move to Hungary, please.
Yes, I'm here. Sind wir weg? Oh, we're still live. Okay.
Hello, can you hear me?
We need a dinner speech.
Hungary, please?
You are.
Hi, Geza. Are you back on?
Yes, we are here. Can you hear us?
Yes, I can hear you nice and clearly. Sorry about the technical glitch.
Manuel,
You're live. Please go ahead
no
with your valve
problem.
deployment.
Okay. So this is National Cardiovascular Center from Budapest. Next to me is Peter Andreka. Do you want us to have a short introduction to the patient we want to treat? Or just go ahead with the deployment? Can you hear us?
Yes, we can hear you and we can see you. Please go ahead.
Okay, we go ahead with the deployment. We cannot hear you. I guess we lost the connection.
Yes, but we can see you nicely. We can see the valve being crossing. Please go ahead.
Okay, can you hear us?
I can hear you nicely. I see you're using a co-valve, Evolute R from Medtronic.
Yes, it's an Evolute Pro valve in an 80-year-old patient.
Super.
With a peak gradient of 130, so it's an extremely calcified valve. We are trying to align the catheter, and we start the deployment. We had to do a pre-BAV before because it was extremely calcified.
Okay.
So now the valve is ready to open. We check the depth. Unfortunately, the picture is not at the deepest point because there is so much calcium that the picture is not able to enter. Good, so we are at the moment at about 2-3 millimeters. So we are happy with the depth of implantation. So we go forward until the point of no recapture.
Okay.
So now we are at the point of no recap.
Okay.
We do the contour angio. I think the depth is pretty good. There is no parallax. So I remove the pigtail and we drop the valve where it is. So we ease the tension from the wire and deploy the valve. It looks pretty nicely open.
That looks fantastic, as always, Geza. I couldn't expect anything less from you.
Thank you very much, Dr. Gopal Murugan. Thank you for your kind words. Okay,
Thank you very
we
much.
are done.
You get on and you please stay there online. I'm going to come back to you. We're going to move to Raj Makkar at Los Angeles, Siddhar Sinai.
Good. Thank you, thank you.
Let's move to Siddhar Sinai at the West Coast, USA, please. Raj, are you there? Ujwal, could we connect Los Angeles, please? We have China ready, so let's go to China. We have Professor Jianan Wang and Professor Liu. I can see you both. Hello, professors.
Hi. Hi, Gopi.
Hi, how are you doing? To my left is your good friend Prashant Vaijanath and Anant Raman here.
Hi, Lou.
Good to see you all.
Hello, President Wong.
Very nice to see you online.
Thank you very much. And this is, I take it, at 8:30 p.m. in China. Thank you so much for accommodating us and for supporting this campaign. We'll let you get on with the valve deployment. Please tell us a few bits about your valve, what valve you're using, bicuspid or tricuspid, and please show us the valve deployment.
Next, Rahul Sharma.
Okay, so shall we very quickly to go through the case?
Yeah, you can go straight for the valve deployment.
Okay, the case, please. The slides, please, very quickly to go through the case. 来把 PPT 切出来。来把 PPT 切出来，导播。你叫导播把 PPT 切出来。Okay, the patient is 71 years old, the female, and is a very small lady, and the patient, the kidney and the liver function is not so good, and has a history of diabetes. And the STS score about 8.8%. Next one. And the echo showed that very severe stenosis and also the severe aortic regurgitation. Next one.
So Leo, you can go straight to the valve deployment.
Okay. So we will use the Venus A Plus today. Okay,
Venus A
next
Plus,
one.
fantastic, great. We're looking
Yeah,
forward.
so you can see there's no calcification for the patient. Yeah, very thickening leaflet. Yeah, so this is a very challenging case. No
Yes.
calcification and the very thickening leaflets. Okay, today we will use the Venus A Plus. So you know quite well of the Venus A valve.
Yeah, we've done that here with your help. You know that. So
Okay, the valve, please. Yeah, the radial force is very good. So this is the very special design for the very severe calcification and the bicuspid AS. So however, you know, for the thickening leaflets, it still works quite well in this kind of.
So Professor Leo, we'll let you get on with the procedure. We're just going to move to Stanford University at the west coast of USA, and I'm going to come back to China in 2 minutes. So you carry on, keep recording. Let's move to Stanford University. Give us San Francisco, please.
我生气了已经。他因为时间9点钟到了。
Ujwal, can you give us San Francisco?
Done.
Okay, we're ready? Okay, we're going to go.
Hi, Rahul, can you hear me?
Gopi, how are you? Good morning from San Francisco.
Good morning, my good old friend Rahul. Thank you so much for being here at 5:30 a.m. in the morning. I'm not sure I would have done that, but thanks so much. It just shows your dedication and commitment to the whole campaign. I'm ever so grateful to you and your team, Michael, and more importantly, David.
Hi, Gopi. Good morning. How are you?
Hi. How are you? So thanks for coming in. We'll let you get on with your case. Rahul, just tell us a few things about your case and show us your deployment.
Sir, next is Dr. Nagawati.
Rahul, we can see your valve already crossed the arch and you're about to position it.
Sure thing. Thank you, Gopi. Well, before I go into the case, you know, it is bright and early here, but I need to thank and recognize the wonderful team I'm working with. Got Dr. Mike Fishbein on my right, cardiac surgeon, our fellow Brian Lee, Edmund, we have Amin, we have Dr. Alan Young. Yep, valves across the arch.
Yes,
we've got the
we can
anesthesia
see it
team.
nice and
We've got
clearly.
Dr. Jess Brote, Dr. Prin. And we've got Gina from Edwards, we've got Bryce, we've got Stephen. Hopefully I haven't missed anyone else. And we're going to go ahead. It's an 85-year-old gentleman, high risk, and we're going to use a 29 Sapien 3. We've already gone across the arch, and so we'll go ahead and deploy.
Great. We're waiting to see.
Test, please. I'm going to push it back there. Test, please, Brian.
Just a reminder, Dr. Nagawati.
Okay, mag in, please. Test again. Okay, is everyone ready? Okay, pacing on at 180. Inject, please, Brian. Okay, I'm pulling it up. Let's go.
The valve position looks perfect to us from here.
And pacer off, please. Okay, there you have it. Our valve is deployed.
Fantastic.
Hemodynamics are rebounding nicely. A little bit of a conduction delay, a bit of slowing, so we're going to pace.
Fantastic.
Just pacing
We
at
couldn't
80.
expect anything
There was an
less
underlying
from
right bundle branch block,
Rahul
so
and Michael and Stanford
we'll see if
University.
this recovers.
So great case.
But hemodynamics are looking good.
Rahul, great case. I'm going to let you
we'll
get
go
on.
ahead and check
I'm going to
pressures,
move to
but,
another center. I'm going to
sure
come
you want
back to
move
you.
on, so I just want to say thank you, Gopi, and the World Heart Center for the honor and privilege of being part of this monumental and historic event. I think it's a wonderful initiative.
Stay
to
online,
highlight the
Rahul. I'm going to
importance
come
of
back to you.
cardiovascular disease on World Heart Day, even in the midst of what's happening around the world with COVID. And it's our pleasure and honor to be involved, and thank you to all of you.
Ujwal, can we move to Bangkok, Thailand, please? Dr. Nuttawut. Ujwal, let's get us
done.
Dr. Nuttawut from
Yes.
Bangkok. Can you hear
Thailand.
us?
Yes. Yes, we hear you.
Hi. Hi.
We're from
Thanks for
Celiac
coming.
Hospital, Bangkok, Thailand.
So
I
we
have
have
Dr.
Dr.
Naratip with
Nuttawut
me here.
and Dr. Naratip from
Hello.
Bangkok, Thailand. Please go ahead. Tell us about your valve and go ahead with the deployment, sir. Thank you for being here.
Yep. Yes, I'm very grateful to be here. So we're from Thailand team, and this is Edward valve. Gradient on the patient is 73. So 81 years old with low risk for AS.
Yeah.
So we're just about to deploy. Okay, crossing the valve, and then I need to resheet.
So this Edward Sapien tree number 23.
Yes, we can see it nicely and beautifully. Go ahead.
Injector na.
So the challenge today is the gradient is very high. So
and patient have very narrow LVOT, so we can just use nominal pressure. พร้อมนะ inject ก่อนนะครับฉีดครับยังไม่ต้องเทส Okay. It look like position we can aim a little bit high. We might need to come down a little bit. Okay. Okay. ขอ inject อีกทีนะฉีดครับโอเคน่าจะได้นะกันอีกนิดนึงนะโอเคได้มั้งพร้อมนะ
Okay, it looks pretty
so,
good.
Rapid pacemaker on. Okay ครับ inject. Okay, slowly inflate. Full.
1,000, 2,000, 3,000.
Deflate. Pacemaker off. So we just deploy the valve. So we have Dr. Desho, our chief cardiology, to help up on the echo.
Great.
You can see the screen. The valve position looks not much probably.
Sure. I think this is the beauty of the system that you're using, where
Yes.
you can actually reposition, and I think we're all seeing that. It's a fantastic system where you can reposition, recapture, so that we get the best for the patient. Fantastic, fantastic.
Yep. Yeah, and this is you can see the position, the pressure has come back very good. And
Dr.
this patient has
Nuttawut,
challenging
I'm
calcium
gonna
in
let
LVOT.
you get on with your procedure.
Okay.
I'm just gonna move away. I'm gonna come back. Please keep recording. We're gonna come back to you very shortly.
Okay, we'll do.
Ujwal.
Okay.
Who's next?
Teen switch. Done. You're live.
Yes, that's not my question though, but the microphone that I'm
Raj
talking to
Makar
you
ready?
through right now. Yes, we're ready.
Raj, can you hear me? Los Angeles.
I can hear you.
Ujwal?
Yes, sir, they're ready. They're ready.
We're
Hi,
here.
Raj.
Los Angeles is here.
Hi,
No, this
Jubin.
is Dave.
We can see you now. Thank you very much again for being there at 5:30 in the morning. You probably got up and you came to work at 4 a.m. I'm ever so grateful. And Raj, you've contributed so much to the TAVR development in India. I'm very grateful for joining us, bro. Get on and tell us a few bits and pieces about your cases, and we are waiting to see your valve deployment.
Okay, terrific, Gopal. So This is, first of all, I want to thank our staff here and my colleagues here for coming so early in the morning. This is the 82-year-old lady who's actually post-bypass surgery, now has severe aortic stenosis and some aortic regurgitation. You can see we've protected the brain by putting in the Sentinel device. That actually, you can see the two filters up there. And we are now going to come around the aortic arch and deploy the Sapien 3 valve, the Sapien Ultra valve. All right, so this is, we are flexing around the aorta. Okay, my colleague Mamu is giving me some traction with the wire. All right, can you let the wire go, please? All right. So this is, we're going to go ahead and advance this. Come back a little bit with the catheter here. Yes, please. All right. Is this our deployment here? Okay, terrific. So we are going to, the challenge here is that this is small anatomy. The annulus is very small. We've chosen a 20-millimeter valve, and the OT is yet small. The STJ is also small, so we have to balance all of these things. Okay, so we'll go ahead and be ready for deploying now. So my colleague, Dr. Wen Cheng, is going to be taking the balloon up. Okay, pacer ready, pacer on, please. Inject, please. Okay, go ahead, please. Deploy, deploy, deploy. All right, balloon up. Down, please. Off, please.
Dr. Gopal, please ask Dr. Raj not to show the patient.
All right. Can you see the valve?
Raj, if you can move your cameras away from the patient, please.
Okay, so can you go ahead and show the valve deployment? Were you able to see the valve deployment?
Yes, we all saw that beautifully. We can see that.
Excellent.
Perfect.
You can see the rhythm. The rhythm is now stable. The blood pressure is back up.
Fantastic. We couldn't expect anything less from you, Raj, there. And thank you very much for being there. We're just going to move on to the next country. I'm going to come back to you, Raj. Please stay with us. It's a fantastic outcome. Ujwal? Can we go to South America, Ujwal?
Dr. Rahim Gul,
Okay, so let's move to Saudi Arabia if they are ready. So we're going to Qasim, Saudi Arabia. We have Dr. Rahim Gul. Dr. Rahim Gul, can you hear us? We can see you nice and clear.
Yeah. Hi.
Fantastic.
Rahim, hi.
You're live here, Rahim, and we're waiting to see your valve deployment. Go ahead.
I want to introduce my colleagues. My colleague is Dr. Akram. He's a consultant intervention cardiologist with us, and also our other doctor, Dr. Imtiaz here, anesthesia, and Suleiman, he is the chief of the technician. My case is 77-year-old gentleman. He has diabetes mellitus, hypertension, and ischemic heart disease. He was presented with severe symptomatic aortic stenosis. Now the aortic wall is tricuspid wall because the age 77 years. Nearly after 75 years, we are deploying the tower. So it has been discussed in the heart team, and the heart team decision was to deploy to do the tower for the patient.
Okay, great. Show us the valve deployment. Please go ahead. Ready.
The perimeter is 77, and also the annulus 24.5. So now today we bring in the patient for the tower to deploy it. We already crossed the wall. Almost we are deploying the wall.
Please show us the valve deployment, Rahim. We can go straight for the valve deployment.
After this, Dr.
So can you see the imaging, please? So this is the imaging, initial imaging. Now next, go next. This is the wall. So our wall is only 2 millimeters down to the annulus. We can see very clearly we deploy the wall there. We are going to deploy the wall. No more. Go more. Go more, please. Now the wall position is a very good position on the wall. There's some thermal leakage here, but the position is very nice. And we did the echocardiogram also. The anterior left upper marker was okay. There's a chest marker regurgitation is there. Now we are going to deploy the wall. So that's the releasing. We want to release the wall, and we are going to do a final injection, and then we release the wall. Can we do final injection, please? So that is the thing. The wall is in a very good position, and our the femoral lux is very low, and also the mitral regurgitation is minimal mitral regurgitation is there. We are in a good position to deploy the wall. Now we are releasing the wall.
Fantastic.
Yes.
Looks fantastic, Rahim. That's an excellent outcome. So we're going to move on to USA again. We're going to move to Buffalo, East Coast. I'm going to come back to you. Stay live.
Some tension on the wall, and we are releasing the wall.
Let's move to Buffalo, USA.
Yes. The wall has been completely released. Yes. That's okay. Now,
Ujwal?
We remove. Yes. We are going from out, put the wall.
Ujwal, could you connect us with Dr. Vijay and Dr. William Morris at Buffalo, USA? Hi, Vijay. We are live with Dr. Vijay Iyer and Dr. William Morris at Buffalo, the East Coast of the United States. Thank you so much, Vijay, for all your contributions to the TAVR growth in India, and we are very delighted to have you there. Very good to see you there. We're ready for you. We can see you there. Thank you, team, for coming in so early. Please get on with the valve deployment, and we're ready to see you in action. Yes, we can hear you nice and clear. Go ahead, bro.
Next is Dr. Diego.
Vijay, you can go ahead. We can see you. Nice and clear. Please go ahead with the valve deployment. Okay, great. We can see you nice and clear, and we can see you crossing the valve nicely. So, and we can hear you too. So go ahead, Vijay.
So continue the interaction. The last one is a bit tricky.
Yeah, beautiful deployment. We can see that. Fantastic, Vijay. No, we are very happy too. We saw it. Absolutely fantastic. Superb. Very good. And please stay online, Vijay. I'm going to come back to you. I'm just going to move away. I'm going to come back to you very shortly. Great, great procedure. Thanks, Vijay. So, ladies and gentlemen, we'll get on with our valve procedure. So I'm going to let my colleague here, Dr. Anantharaman and Dr. Prashant, get on with the valve deployment while I go through the history. So let's show our fluoro screens, please. So here we're almost ready. We have a 70-year-old man who has significant symptoms of shortness of breath and chest pain. He was very worried about coming into hospital to have a valve replacement. He was in fact low risk for surgery, but we offered him TAVI. Given the current evidence and the current scenario, he agreed. Now we're putting in a 20 millimeter Edwards Sapien S3. You can see here we've already crossed the valve, and my colleague is going to position this, and we're going to get on with valve deployment. Okay, push her back. Ready for pacing. Pacing on. We're happy with the position. We're going to go ahead and deploy it. Off you go, off you go, off you go, off you go, fully on. 1, 2, 3, down. Pacing off. Breathing on. Okay, great. We're happy with the valve position. Let's get the delivery sheath out and let's do an iotogram.
Next is Dr. Abdul Rahman.
So there you go. It's a very fairly high implant. We wanted a high implant to make sure we don't give a pacemaker to the patient. The patient is stable. We have very good parameters, and we are done here. We are happy. So let's move on to the next center. Ujwal?
Yeah, Abdul Rahman. Dr. Abdul Rahman is live. He will go
Okay,
next.
great. So let us move on to Qatar. We have Dr. Abdul Rahman Al Nabti from the Heart Hospital Hamad, Doha, Qatar. Hello, Dr. Abdul Rahman. How are you? Can you hear us?
Remove your hand كلش يا دكتور. Okay,
can we get Dr. Abdul Rahman on the screen, please? Doha, Qatar.
Hello, this is Dr. Mohammed. We're working with Dr. Abdurrahman. Yes, can you hear us?
Yes, we can hear you nicely. Could we get the video on, please? Great, we can see you and we can hear you. Dr. Abdul Rahman, please show us the valve deployment.
Okay. Can you hold it? Over.
Great, we can see you and we can hear you.
Great. So we have a team of Dr. Abdurrahman, Dr. Salim, Dr. Sami from anesthesia, Dr. Khalid Al-Qadi. We have Raj, Praveen, and Hamad Ishaq from the TAVI team here. So we have a patient who is 69 years old with a history of diabetes, hypertension, and CKD with intermediate risk for TAVI. He has his main indication is a severe aortic valve stenosis. He elected to undergo TAVR. He also has a BMI of 45. So his annulus perimeter is about 75. So we decided to go with
Dr. Abdul Rahman, please get on with the valve deployment. So please show us just the valve deployment.
So we'll show you right now the deployment on the screen. So here we are checking the valve alignment. Next. Right.
We use the Evolute R valve 29.
Yeah, we can see that nicely.
We choose the balloon 29, 22 size, so we have to 29 valve. This case was borderline between 26 and 29 valve. Evolute R. This is the process.
We can see the Evolute R nicely going up, being positioned.
Aggressively. So we have a pop-up of the valve, so we have to go in again. There's more aggressive bracing up to a rate of 150. And we were able to place the Evolute R with a more steady position, as you can see here. So next. This is with more release, so we were happy with this. We kept some pressure on the device forward, and we continue to release more and more. And this was the final release. So we were happy with the position, and at the same time we were happy with.
That looks pretty good here. We're going to let you get on, Dr. Abdul Rahman. We're going to move to. We're going to move to South America. We're going to move to Sao Paulo. We'll come back to you. Let's get Sao Paulo, please. Can we get Diego Gaia from Sao Paulo, South America?
Yes, they're live.
Can we see the screen? Hi, Diego. Can you hear us? Can we get Sao Paulo, please? South America. Yeah, hi. Can you hear us, Diego? Very well, very well. Hi, Diego. We can see your screen nicely. Looks like you're positioned the valve. We have Dr. Prashant, your friend, to the left also.
Hi, buddy.
We can hear you nicely. Please get on with the valve deployment, Diego. Yeah, we can hear you. There is a bit of a lag. Please go ahead with the valve deployment. Yes, we can. Please go ahead.
Yes, yes.
So next is Dr. Khalid.
Khalidanbag.
Fantastic. That looks really good, Diego. Beautiful deployment. We can see it nice and clearly. Diego, my friend, just stay there live. We are going to move to Iraq. I'm going to come back to you. So you please stay there live. Let's move to Iraq. Let's get Dr. Khalid Amber.
Yes. Yes. You hear us or not? Yes, yes. You can see Iraq.
The sound is low.
Ujwal, can we
Okay,
get...
start to deploy or wait?
Ujwal, can you...
Okay.
Okay, great. We have Khalid Amber. Hi, Dr. Khalid Amber. We can see you.
Hi, Gubi.
Khalid Amber is at Najaf at Cardiac Center, where you can see Dr. Khalid Amber, Dr. Ahmed Rajib, and Dr. Amar Al-Khalidi. Khalid, hi. This is Dr. Prashant here. We've been there in your lab, and it's fantastic to see you there. It's all deja vu, so it's fantastic there. So we're ready. We're seeing you nicely. We can clearly hear you. Please get on with the valve deployment. We're looking forward.
Okay. Okay, this is Dr. Rajesh, Dr. Khalid Ambar, Najaf Cardiac Center, and this is my team, Dr. Ahmed, Dr. Ammar, and Dinesh, and Dr. Ali is the anesthetist. And good afternoon to you and to all the experts in the tour. The history of patient is 75 years old. He is severe COPD and severe LV dysfunction. Almost we just stabilize him because he has pulmonary edema. His ejection fraction about 30. And regarding his family, regarding his hypertension, smoker, and that's all. His annulus area is about 75. Sorry, 27.5.
Please get on with the valve deployment straight away.
We'll proceed the deployment. Please put the اوكي شوف السبت السابع بالله
Okay, we can see the screen here. I see you have positioned a valve already. We can see the screen nicely.
spacing, please. 180. 180. Stop facing. Please.
Fantastic. That's the valve deployed already. That's great. Khalid, we can see it nicely. Beautiful deployment. We're just going to move away to Australia. I'm going to come back. Please stay with us. We'll be back very soon. Fantastic case. Beautiful result. Let's move to Australia, please. Let's move to Sydney.
Sydney? Sir, all the live transmissions are over, so we will have to conclude with your case now.
Can we move to Sydney?
Sir, all the live transmissions are over. They've all finished their cases. We will have to move on with your concluding slides or presentation.
Sydney.
Sydney is a recording.
Let's play that. Can we get Sydney, please? Or we can get West Virginia. Can we get Ramesh Nagawati? Or we can get Dr. Andrew Viper from Blackpool, UK. Whoever's ready. Ujwal?
He's asking me if he's Sydney is a recording. Do we need to play that?
Yes.
Thank you.
Who are we getting next there? Ujwal, please tell us who we are connecting to.
Sydney.
Okay, great. So we have Sydney now. We have Dr. Professor Ravine Bindi with Dr. Peter Hansen, Dr. Chris Chonak, and Dr. Roger Levi from North Shore Hospital, Sydney, Australia. We can see the valve.
Okay, so we're going to do a
Ravi, thank you
injection
very
here.
much.
We're going to pace and ready, everyone?
Please go ahead. Go ahead.
Ready, Kate? 10 out of 10. Okay, pacing on, please. Inject, please. Pacing off.
Thanks
pretty
a
good.
lot,
Yeah.
Ravi, for being
Okay,
there
ready?
at 10:30 p.m. at night. So we're
Facing
very
on.
grateful. It just shows your commitment for the campaign.
Pacing on.
You can see the valve positioned.
Inject, please. Go, thanks, Peter. Pacing off. So come down. Pacing off, please. Yeah.
Great. That's the valve deployed. We can see nicely. It looks beautiful. So Ravi, we're going to move away from Australia. We're going to move to France. We're going to see Alan Cribier in action, and I'm going to come back to you. Please bear with me. Stay there. Stay online. Let's move to France. Let's move to Rouen. Let's see the man who invented TAVR procedure, Dr. Alan Cribier, along with Professor Helen and Dr. Eric Durand. Can we move to Rouen, please? Digital director, can we move to Rouen? Okay, great. Are we on Rouen? Professor Cribier, can we see you? Can we hear you? Ujwal?
Yes, they're live.
Okay, great. We can see you. Professor Cribier, hello. Very nice to see you. We can see you nicely. Please get on with your valve deployment. And we will chat again. Great. Already done. Superb. We can see you've done a Sapien 3. The iotogram looks beautiful. Beautiful transmission, beautiful outcome. Fantastic, Professor Kribia. I'm going to come back to you. Please stay online. I will come back to you. We're just going to connect to UK with Blackpool, UK. Let's go to Blackpool, UK, please. Let's move to Blackpool, UK.
Thank you.
Are we at Blackpool, connected to Blackpool?
Thank you.
We're still on Alan Kribia. He's finished the procedure. Can we move to Blackpool, UK, please? Ujwal? Ujwal, the digital director, can we move to Blackpool, please? Or could we move to West Virginia, East Coast, USA?
Yeah, so we are on with
Who are we with?
Check. Doctor, can I just request you to hold on just for a minute? Because we'd like to just take this moment to extend a heartfelt gratitude and appreciation to our chief guest for the day. We will continue, sir, but we'd also like to formally welcome you. We have with us a gentleman who needs no introduction, someone who's been an incredible source of support from day one. We have with us Dr. C. Vijay Bhaskar, Minister for Health and Family Welfare, Government of Tamil Nadu. So thank you so much for joining us today. இன்னும் ஒரு 10 நிமிஷத்துல நம்மளோட இந்த ப்ரொசீஜர் முடிஞ்சிடும். Thank you so much. On to you, Dr. Gopal Murugan.
வணக்கம் டாக்டர் விஜய் பாஸ்கர். நன்றி வந்ததுக்கு. இன்னும் ஒரு 2-3 வால்வு தான், மொத்தம் 10 வால்வு போட்டு முடிச்சாச்சு. இன்னும் ஒரு 2 வால்வு முடிச்சிட்டு நான் உங்களை வந்து சந்திக்கிறேன். தயவு செய்து கொஞ்சம் பொறுத்துக்குங்க. So we're all now connected to Blackpool, UK. Hello team, thank you for coming there. Let's get on, and I'm waiting to see your valve procedure.
It's David Roberts and Andrew Viker and the TAVR team here from Blackpool.
We're back to Andrew. What are we playing right now?
Let's get on with the TAVI valve
Can you
deployment,
hear us,
please. We can see you nicely. We need to see the deployment. Ujwal?
So we are already live with Dr. Khalid. Sorry, Dr. Andrew.
We have to see the valve deployment from Dr. Andrew Viper. Ujwal?
Hello, can you hear us?
Yes, we can hear you. Just a small technical glitch. Please bear with us.
No problem.
So you might have to ask them again to show the result or the message or something.
We need the valve deployment. Could you please show us your valve deployment, please?
Well, we've sent it to you. You should have it. We sent it to you on the cloud.
We'll be there in 2 minutes. We're going to be there again. Ujwal, could you please connect to West Virginia? We'll come back. Ujwal.
So can we ask?
Yeah, just have it.
And just move on to the vote of thanks something.
Why?
We are done with the transmissions.
You don't understand. Get Samina to speak to me, please. Okay, let's get on with the message to the world. I think we're pretty much done with most transmissions. So shall we start with our message?
Yes, doctor.
Do you want to wrap up, Samina, and then we'll be on the stage?
All right, thank you so much, Dr. A.B. Gopalamurugan, and all the other doctors from various centers across the globe for giving us that very insightful, brilliant panel discussion. Now, may I quickly request all the 20 doctors from different centers to kindly come live for a photo op session or digital photo op. I'm going to request our press and media folks to just remain seated. This is just a digital photo op session. If we can just request everyone to quickly come live, please. If I can request the moderators. Also would I'd like to take a moment to just extend our appreciation to all our moderators. We have 20 moderators who are sitting at the far corner of the hall who've been working tirelessly. As you can see, it's technology, it's a brand new platform. We've had a lot of hiccups, but these folks have been working tirelessly. Thank you so much for the support that you've given us. Just a few more minutes, if we can have everybody come live. Yes, wonderful. So I think we can go ahead and have our doctors address the gathering, address the world. Can I request the moderators to kindly help us through this, please?
It's been our pleasure to be here and be part of the TAVR World Tour. I thank my entire team, my cath lab team, the anesthetic team, the nursing team, the technical team, and nearly about 200 people who've been working relentlessly to try and get the TAVR World Tour conducted. So we will move on to each center. I would request each center to give a message to the world for about 20-30 seconds. Over to you, Samina. I'm going to jump onto the stage. I'll see you there very shortly.
Great. Thank you so much, Doctor. I think it's time for us to see you in person. So while we wait for the arrival of Dr. A.B. Gopalamurugan, we're going to go ahead and hear what the other doctors from the other centers have to say. I think we will begin with Denmark. Can I request a team from Denmark? We have with us Dr. Lars Sondergaard.
Okay, Lars. I'm Lars Sondergaard, and I'm honored that the Copenhagen team in Denmark has been part of this important event, the TAVR World Tour, and we hope that this is going to facilitate treating patients with heart valve disease across the world. One team, one heart.
Thank you so much, Doctor. We now move on to Dr. Raj Makar from United States. May I request?
Yes. Dr. Makar?
May I request Dr. Raj Makar to kindly address the gathering and address the world that's watching this event live?
And we want to tell our patients who have heart disease across the world, to not be afraid in seeking help. As you just saw, we can safely do these procedures, and these are actually life-saving procedures. So good health to everyone.
Thank you, Doctor. We now move on to New York. We have Dr. Vijay Iyer, who's going to be addressing the world.
He's like, I want to tell the patients. Yeah. He's...
Okay, thank you.
Doctor, may I request you to kindly address the world, please? Just share your thoughts with us today. Thank you, Doctor, and thank you for being a part of the TAVR World Tour. We now move on to San Francisco. We have Dr. Rahul Sharma from Stanford University. Dr. Rahul Sharma, may I request you to kindly share your thoughts with us today, please?
When?
One.
Stay safe, everybody, and we wish you all the best. Thank you.
Thank you so much, and thank you, team, for being a part of this event.
Good. Can you hear us? Good. So this year we are full of fears and insecurities, but I think today together we could show to the world, to each other and to ourselves that we are alive and we are going to survive. We would like to thank the organizers for making it possible. And finally, one team, one heart.
Thank you so much. Thank
you very much.
Thanks. Bye-bye.
We now move on to Saudi Arabia. We have with us Dr. Rahim Gul.
Yes, we are ready. This is Dr. Rahim with you. We are ready. Yes. Yes, yes. Hi.
Doctor, may I request you to address the gathering, please?
Yeah, this is Dr. Rahim from Kingdom of Saudi Arabia, the Prince Sultan Cardiac Center. We have a case which was 77 years old gentleman, severe aortic stenosis, symptomatic, and the patient was, the TAVR workup was done, the team was decided, the heart team was decided to have wall implantation through the percutaneously. So we did the CT scan. The CT scan was suggested the wall size 29 millimeter. So we bring him today to the cath lab, and the patient was deployed. The wall was deployed successfully. It was 29 size, and there are no paravalvular leak, and the patient has an excellent result, and the mean gradient is 1.5, and there is zero gradient hemodynamically. So this is the wall. You can see the wall deployment. Can you go more? And this was the release of the wall. You can see the release, very slow release, gentle release. Next, can we see next? Next, please. And this was the final injury of the wall. Can we see next? Next is the final. So there was no leakage, and at the same time, there are no Bunderborn blocks. The conduction system was normal. And at the same, we did the echo. Also, there was no paravalvular leak, and we did the hemodynamics. There's zero grading across the wall. So we remove all the lines. Now the patient has now 0 lines. The temporary pacemaker is removed. The lines, the arterial line is removed. So the patient is in a very good, stable condition. And all the procedures were done under only local anesthesia. There's no conscious sedation ever, and the patient tolerated the procedure very nicely. Yes. Yes, please.
Thank you so much, Doctor, for sharing your thoughts with us and your expertise. Up next, we have Dr. Mehboob Ali from Saudi Arabia. He's going to be sharing his thoughts with us.
Yeah.
Doctor, we're waiting to hear from you. If you can just...
Yeah. Shall I start? Hello, everyone. I'm really glad to be part of the TAVR World Tour. And it was really an enlightening experience, and we could see lots of centers participating, and it was a show of solidarity, and the future is there for transcatheter heart valve management. Thank you very much for the organizers. One team, one heart. Thank you so much.
Thank you so much, Doctor. Up next, we have Dr. Khalid Ambar from Iraq.
Iraq. Yes. Hi. Lots of centers participating. Transcatheter heart. Thank you very much for the organizers. One team, one heart. Thank you so much.
Thank you so much, Doctor. Up next, we have Dr. Khalid Ambar from Iraq.
Yes, thank you. It's our pleasure. It's our pleasure to be a part of TAVR World Tour in this hard day. It's a pleasure to be showing the whole about that doing a TAVI disease is being treated. Very important because it's more risky and more killer than the COVID. So just so it's simple, easy to be done, safe, done continuously, no GA, and our severe and this kind of yes, it's already some very, very good situation. So it's very nice to be a part of these things, and it's our message that that's one team, one heart. One team, one heart.
Thank you to the entire team. We now move on to Brazil. We have Dr. Diego Gaia, who's going to be joining us. We can see you and we can hear you. It would be great if you could share your message to the world. Thank you so much, Doctor. Thank you for your message. Up next, all the way from Australia, we have Dr. Ravinay Bindi, who's going to be joining us.
All right. Thank you very much for the opportunity to participate in this wonderful event in the middle of a pandemic where we're treating patients with severe critical disease with a really effective therapy that helps not only those patients with heart disease, but also helps reduce the burden on our hospitals as well. So thank you very much for highlighting this very important cause during World Heart Day.
Thank you so much, Doctor. And up next, from Blackpool, UK, we have Dr. Andrew Wiper.
Thank you. Thank you. It's David Roberts and Andrew Wiper and all our excellent TAVI team in Blackpool here. And we wish to thank you for inviting us to be part of the World TAVI Tour. We enjoyed it greatly. We did a day case procedure yesterday in the Kauvery area, very successful, and that will be our 13th TAVI that we've done as a day case in Blackpool. So our TAVI team wants to thank you, and I'd like to give you a message. Go on, team, give them a message.
Thank you so much. That was really sweet. Thank you so much to the entire team. Up next, we have Dr. Natawat Wanpapara from Thailand and his team.
Are we on? Let us. Are we on? On, me? Are we ready?
Yes, if you could just go ahead and address the world, please.
Go ahead. Okay. All right. Sawadee krap. We are from Silat Hospital, the oldest and largest medical school in Thailand. Our mission, our life is saving patient life. Hey. ฮะไม่ขึ้น อันนั้นใหม่เหรอ Are we on? เขาบอกให้รอก่อน
Thank you. Thank you. And we'll let you go ahead and celebrate. Thank you so much. Up next, we have Dr. Ramesh Nagawati from USA.
Yeah, hi. This is Ramesh Nagawati from West Virginia University. Great pleasure to see all of you on World Heart Day. And this is a fantastic moment for TAVR World Tour. I'm part of one team, one heart. Thank you.
Thank you so much, Doctor. Thank you for your message to the world. Well, ladies and gentlemen, it gives me great pleasure to welcome on stage a very special gentleman who was actually originally supposed to be a part of the TAVR World Tour himself and was supposed to be live with us on the platform, but instead we're lucky enough to have him here in person. Can we all put our hands together and welcome Dr. Vaiko Mahadevan, world-renowned cardiologist from California. Big round of applause for him. Doctor, may I request you to just kindly come forward and share a few words with us, please. Check. Check. Check.
Thank you very much. மாண்புமிகு அமைச்சர் அவர்களே, திரு அரவிந்தன் அவர்களே, Dr. Gopala Murugan அவர்களே, this is a fantastic effort by all of you. During this very difficult time of COVID, we are trying to give appropriate care to our patients. That has become very difficult because of patients not wanting to come to get appropriate treatment. I think Kauvery Hospital under Dr. Aravindan's leadership and Dr. Gopala Murugan and various others in the team have put together a fantastic effort to bring all this together and to show patients that it is possible to give safe care even during the time of COVID for life-saving situations like severe aortic stenosis. I recently did a program in the US too, showcasing this, and which was broadcast on local television. And I can say these type of programs are extremely important for patients to understand that they should get appropriate medical care so that they can be served better. And I again congratulate Dr. Aravindan and Dr. Gopala Murugan for putting together this fantastic effort. தமிழகத்தில் கோவிட் பாதிப்பு இருந்தாலும் அது மிக நல்ல முறையில் மேனேஜ் செய்யப்பட்டுள்ளது. அதே நேரத்தில் மக்களுக்கு கோவிட் வைத்தியம் எப்படி முக்கியமோ இருதய சிகிச்சை மிகவும் முக்கியம். அந்த இருதய சிகிச்சை தக்க முறையில் மிக நல்ல விதமாக செய்ய இப்படிப்பட்ட நிகழ்ச்சிகள் மக்களுக்கு மேலும் கான்ஃபிடென்ஸை கொடுத்து சரியான நேரத்தில் வந்து ட்ரீட்மெண்ட் செய்து கொள்ள உதவும். அனைவருக்கும் நன்றி.
Thank you so much, Doctor. Very excited that you could join us here today and be a part of the TAVR World Tour. And up next, ladies and gentlemen, I'm going to welcome on stage the man of the moment, the man who conceptualized the TAVR World Tour. So can we put our hands together and welcome Dr. A.B. Gopalamurugan of HeartTeam India to share a few words.
எல்லாருக்கும் வணக்கம். Respects to Honorable Health Minister, Dr. C. Vijay Bhaskar. Thank you very much for coming here, sir. And my respects and wishes to Dr. Arvindan, our Executive Director for Kauvery Hospital. ஏன்னா அவர் உதவி இல்லாமல் இது எதுவுமே பண்ணியிருக்க வாய்ப்பில்லை. And my respects to our guest, Professor Dr. Vaiko Mahadevan. In fact, he had to have been here doing a valve because he's much more experienced than all of us, but he couldn't make it. Anyway, in the whole program oda nokam enna ennadan covid la நம்ம எல்லாரையும் covid கஷ்டப்படுத்தினாலும் அதை விட ஒரு more high risk disease is cardiac disease. It's a non-communicable disease. இது காலகாலமாக இருந்துகிட்ருக்கு cardiac disease. கோவிட் வந்து இப்போ கம்யூனிகபிள் டிசீஸ், அதனால் கான்சன்ட்ரேஷன் எல்லாமே கம்யூனிகபிள் டிசீஸ். ஏன்னா குவிக்காக கண்டெயின் பண்ணுறதுக்கு வாய்ப்புகள் இருக்குது. தட் இஸ் வை எவ்ரிபடி இஸ் கான்சன்ட்ரேட்டிங் ஆன் கோவிட். பட் நான் கம்யூனிகபிள் டிசீஸ், ஹார்ட் டிசீஸ்க்கு மாஸ்க் கிடையாது, வேக்சின் கிடையாது. ஸோ அண்ட் தட்ஸ் பீன் தி ஹையஸ்ட் கில்லர் இன் இந்தியா அண்ட் வேர்ல்டு வைடு இன்றைக்கி வரைக்கும். அதுக்கு தான் இந்த வேர்ல்ட் ஹார்ட் டே ஹேஸ் பீன் கன்செப்ஷுவலைஸ்ட். எவ்ரி இயர் இட் இஸ் பீயிங் used as an awareness program, but in the varsha it's even more important so that patients and public understand that if they do have heart disease, if they do have cardiac symptoms, they should not stay away fearing COVID. They should go and get treatment. That's why you've seen 20 centers across the world have all performed a successful valve replacement, live, synchronized within 1 hour during COVID. It just proves cutting-edge treatments are happening safely and securely across the world. கொரோனானால நிறைய ஹார்ட் பேஷண்ட்ஸ் பயந்து ஹாஸ்பிட்டல் போகாமல் அதனால் தீய விளைவுகள் வருது. இதை வந்து முறியடிக்கணும், மக்களுக்கு இந்த மெசேஜ் போய் சேரணுன்ற ஒரே காரணத்துக்காக தான் இந்த இவ்வளோ பெரிய ஈவெண்ட் கண்டக்ட் பண்ணுது. இது கண்டக்ட் பண்ண எனக்கு உறுதுணையாக இருந்த காவேரி ஹாஸ்பிட்டல், இந்த மாதிரி வெரி ஹை அண்ட் ட்ரீட்மெண்ட்ஸ் பண்ணுறதுக்கு யூ நீட் அ வெரி சொஃபிஸ்டிகேட்டட் என்வாயன்மெண்ட். அந்த மாதிரி சொஃபிஸ்டிகேட்டட் என்வாயன்மெண்ட் கொடுத்த காவேரி ஹாஸ்பிட்டல் மேனேஜ்மெண்ட், டாக்டர் அரவிந்தன், டாக்டர் மணிவண்ணன் அண்ட் த ரெஸ்ட் ஆஃப் த டீம்ஸ்க்கு என்னோட நன்றிகள். மோஸ்ட் இம்பார்ட்டன்ட்லி ஆல் த சிங்க்ரனைஸ்ட் ஆக்ஷன் எல்லாமே ஒரு நல்ல எண்ணத்தில். காலையில் சான் ஃப்ரான்சிஸ்கோவில் அவங்கெல்லாம் 3 மணிக்கு எந்திரிச்சு டீம்ஸ் ஃபுல்லாக கிளம்பி வந்து, ஏன்னா யூஸ்வலாக யூஎஸ் அண்ட் யூகே அண்ட் அதர் கண்ட்ரீஸில் தே ஹாவ் அ வெரி ஸ்ட்ரிக்ட் ஒர்க்கிங் பேட்டர்ன். அதெல்லாம் தாண்டி just purely in the interest of patients' health and purely in the interest of this campaign, இது ஒரு fantastic way of propagating good news to patients and public-னால எல்லாருமே முன் வந்திருக்காங்க. China came around at 8:30, Australia came at 10:30 p.m. So இவங்க எல்லாருமே at various times have come together to help patients, and I hope the message has reached patients. I thank all the centers. Above all, பின்னாடி back deskல we have about ஒரு 100 பேர் இதுக்கு வந்து லாஸ்ட் 2 months-ஆக இதுக்கு உழைச்சிருக்காங்க. ஏன்னா திஸ் வாஸ் கன்செப்ஷுவலைஸ்ட் அபவுட் 2-3 months ago. இது எப்படி கொண்டு போகணும், நிறைய சென்டர் போய்ட்டு லாட் ஆஃப் கோஆர்டினேஷன். பின்னாடி இருக்கவங்களுக்கு தான் தெரியும் எத்தனை தடவை அவங்கள அது இதுன்னு சொல்லி உயிரை வாங்கியிருப்பேன்னு. ஸோ ஐ திங்க் they'll all be relieved. Thank you very much for the entire team, entire Kauvery team, marketing team, branding team, and for Guinness Book of World Record who have recognized to come and adjudicate the whole program. Hopefully we will also know whether we did achieve a Guinness Book of World Record, because that was not the primary endpoint. It so happened we happen to be the largest cardiovascular healthcare awareness program watched live simultaneously in the world. So we hope we will hit the numbers. So let's wait to hear from them. And I'll thank you everyone for all your inputs, and I'll welcome our Chief guest, Dr. C. Vijay Bhaskar, to come and say a few words on the stage. Sir.
We also have with us Mr. Narayana Babu, who is going to be addressing the gathering.
Honorable Minister of Health and Family Welfare, respected faculties, deans of the cardiovascular surgery and management. Good evening to all of you. Actually, today we have been very privileged to have the opportunity to say a few words about the World Heart Day. Our government has been concerned with the health care and the heart care of the peoples. We have all the hospitals running their routine treatment during the COVID period, and our program of cardiac care with the hubs and scope model is still alive with Dr. Justin Paul heading the team. So anywhere, any place, a patient with a heart attack is taken for medical treatment, then surgical treatment from the remote corner of the villages to the tertiary care hospital. Our Honorable Health Minister is always very active support of the health care during the COVID period. Even all the hospitals should function along with for the other ailment, also giving the most effective contribution to the COVID. By the way, we have been the forefront in the world to contain the COVID to the least possible transaction, least death, and a higher discharge of more than 91%, and a best management in the government institution for all the poor and needy. And I take this opportunity and thanks our Honorable Minister for providing the best care, for providing the recent care for all the patients attending the government hospitals to have a better and healthy heart. Thank you very much.
Thank you so much, sir, for sharing your wonderful thoughts with us on this gracious occasion. Now, ladies and gentlemen, the vision behind the TAVR World Tour was very simple: to educate and enlighten the world, to convey the message that we need to continue our fight against heart disease more so now than ever, that life-saving treatments can still continue to be administered with the greatest of results despite the pandemic. But little did we know that we were not only spreading awareness, but also setting a brand new world record. As you all know, this entire event today, the TAVR World Tour, is being streamed live on YouTube, and our panel discussion on cardiovascular health has received many views, thus setting a brand new Guinness World Record for most viewers for a cardiovascular heart awareness live stream on YouTube. To tell us more, ladies and gentlemen, joining us live this very moment, we have with us Mr. Swapnil Dangarika from Guinness World Records, a senior experience adjudicator. Can we put our hands together and welcome him, please? He's joining us live.
My name is Swapnil Dangarika. I'm the official adjudicator from Guinness World Records. This was a record attempt for the most viewers for a cardiovascular health awareness live stream on YouTube. Now, we had set a minimum requirement. This record was never done before. So I'm very happy to say that the HeartTeam India, organizing the TAVR World Tour, you have successfully set a new Guinness World Records title for most viewers for the cardiovascular health awareness lesson live stream on YouTube. And congratulations, this makes it officially amazing.
Request Dr. A.B. Gopalamurugan to join us on stage, and also the Minister for Health and Family Welfare, Government of Tamil Nadu, Dr. Vijay Bhaskar, for his timely guidance and encouragement. We'd like for him to join us on stage and receive this honor from Guinness World Records. Ladies and gentlemen, request our friends from media and press to kindly come forward for the photo op session. Can I also request Dr. Aravindan Selvaraj, Executive Director and Chief Orthopedic Surgeon of Kauvery Hospitals, to kindly come forward for a photo op session. Now, ladies and gentlemen, this is no mean feat. Can we have a big round of applause? Come on, all of y'all, if you could just put your hands together. Let's not forget that our folks from Tamil Nadu have stood in the forefront and made this small little idea transform into a glorious reality today.
Congratulations again.
Thank you so much, Mr. Swapnil. Thank you so much for joining us and giving us this great news. Thank you. I'm going to request our chief guest for the day to kindly do the honor of addressing the gathering.
Very good evening to each and every one. அனைவருக்கும் என்னுடைய அன்பான மாலை வணக்கம். I am extremely happy to be in your midst today on the occasion of World Heart Day and inaugurate TAVR World Tour. Today the entire world is facing challenge caused by COVID-19. In the time COVID-19, taking care of your heart is more important than ever before. Tamil Nadu is not only a trendsetter but also a game changer in all the sector. In this context, HeartTeam India under the leadership of Dr. Gopala Murugan and his team has launched live program TAVR World Tour by networking 20 experts from various countries. I place on record my sincere appreciation to Kauvery Hospital, who has created ample platform for this heart-centric initiative. Dr. Gopala Murugan is reputed for his TAVI program. He is associated with Health and Family Welfare Department for his TAVI program. I once again thank Kauvery Hospital, Dr. Aravindan and Dr. Gopala Murugan and his team for these great initiatives which will be etched in this country. அனைவருக்கும் என்னுடைய மாலை வணக்கம். பொதுவாக இந்த கோவிட் காலத்தில் டாக்டர் கோபால முருகன் அவர்கள் சொன்னது போல் நம்ம கம்யூனிகபிள் டிசீஸ் வந்து நம்ம இன்றைக்கி மிக மிக முக்கியத்துவம் கொடுத்துருக்கின்றோம். அதே நேரத்தில் இந்த கம்யூனிகபிள் டிசீஸில் எப்படி நமக்கு ரிஸ்க் ஃபேக்டர் வருது அப்படின்னா தட் இஸ் டியூ டு த நான் கம்யூனிகபிள் டிசீஸ், குறிப்பாக டயபிட்டிஸ், ஹைப்பர் டென்ஷன், ஹார்ட் டிசீஸ். ஸோ இந்த நேரத்தில் நம்ம வந்து ஹார்ட்டை, வால்வை நம்ம சீராக சிறப்பாக வச்சுக்கணுன்றது ரொம்ப ரொம்ப முக்கியமான விஷயம். ஸோ இது ஒரு கின்னஸ் வேர்ல்டு ரெக்கார்ட் கிடைச்சதுக்கு என்னுடைய மனமார்ந்த வாழ்த்துக்கள், பாராட்டுக்களை டாக்டர் கோபால முருகன் இந்த இளம் வயதில் ஹஸ் பீன் இன் யூகே கிட்டத்தட்ட ஒரு 16 ஆண்டுகள். நாங்கள் வி ஆர் ஆல் காலேஜ் மேட்ஸ். ஸோ அதனால் ப்ரௌட்லி இட்ஸ் வெரி ப்ரவுட் டு பி எ ஃப்ரெண்ட் வித் டாக்டர் கோபால முருகன். என்னுடைய பெருமைக்குரிய நண்பராக பார்க்குறேன். ஸோ இந்த இனிஷியேட்டிவ்ன்றது அவர் சொன்னது மாதிரி இது பிஹைண்ட் த ஸ்க்ரீன் பார்த்திங்கன்னா ஒரு 20 கண்ட்ரியில் 20 வால்வை நம்ம வந்து ரீப்ளேஸ் பண்ணி இப்படி ஒரு நிகழ்ச்சியை கோஆர்டினேட் பண்ணுறது த்ரூ டிஜிட்டல், த்ரூ யூடியூப், குறிப்பாக இந்த கோவிட் காலத்தில் பண்ணுறது வந்து நிச்சயமாக ஒரு மிகப்பெரிய விஷயம். இது கின்னஸ் ரெக்கார்ட் அப்படின்ற அந்த விஷயத்தையும் தாண்டி ஒரு மிகப்பெரிய விழிப்புணர்வை, அதாவது இருதயத்தை குறிப்பாக வேர்ல்டு ஹார்ட் டேயில் பிகாஸ் யூ சீசன் த ரைட் டே. ஸோ இந்த உலக இருதய தினத்தில் இப்படி ஒரு நிகழ்வை நம்மளுடைய நாட்டில், குறிப்பாக இந்தியாவில், அதுவும் தமிழ்நாட்டில், அதுவும் சென்னையில் காவேரி ஹாஸ்பிட்டல் ஹஸ் கிவன் அ பிளாட்ஃபார்ம். டாக்டர் அரவிந்தன், டாக்டர் சீனியர் ப்ரொஃபஸர் மகாதேவன் சார் ஆல்சோ ஹியர். ஸோ எல்லோரும் சேர்ந்து இதை பண்ணிக்கிறாங்க. இது டெஃபினட்டாக வந்து நம்ம ஹெல்த் செக்டருக்கு இது ஒரு பெருமைக்குரிய விஷயம். என்னுடைய மனமார்ந்த பாராட்டுக்களை நம்முடைய அரசினுடைய சார்பிலும் முதலமைச்சருடைய சார்பிலும் டாக்டர் கோபால முருகன் அவர்களுக்கும் அவரோடு இணைந்து இந்த மிகப்பெரிய விஷயத்தை உருவாக்கி இருக்கக்கூடிய என்டையர் டீமுக்கும் இந்த நேரத்தில் என்னுடைய மனமார்ந்த பாராட்டுக்களை, வாழ்த்துக்களை நான் மறுபடியும் தெரிவிச்சுக்கிறேன். ஒரு மிகப்பெரிய ஒரு விழிப்புணர்வை இது உருவாக்கி கொடுத்துருக்கு. ஸோ இதன் மூலமாக நம்ம வந்து அவர் சொன்னது போல் எந்த அளவுக்கு நம்ம கான்சன்ட்ரேஷன் ஆன் கம்யூனிகபிள் டிசீஸில் இருக்கோ அதே கான்சன்ட்ரேஷன் நான் கம்யூனிகபிள் டிசீஸில் இருக்கணும். அதில் பர்டிகுலராக வந்து நம்ம வந்து ஹார்ட் சைடு இருக்கணும் அப்படின்ற ஒரு நிகழ்வை முன்னெடுத்து சென்ற டாக்டர் கோபால முருகன் அவர்களுக்கும் என்டையர் டீமுக்கும் ஒன்ஸ் அகெயின் மை ஹோல் ஹார்ட்டட் விஷஸ் டு ஆல்ங்க. டைரக்டர் ஆஃப் மெடிக்கல் எஜுகேஷன் டாக்டர் நாராயண் பாபா ஆல்சோ ஹியர். ஒன் திங் ஐ கேன் ப்ரௌட்லி சே, ஃபஸ்ட் டைம் வந்து டாக்டர் கோபால முருகன் இந்தியா வந்ததுக்கப்புறம் அவர் நம்ம கார்ப்பரேட் செக்டாரில் இந்த TAVI ப்ரோக்ராமை பண்ணால் கூட ஃபஸ்ட் டைம் இன் கவர்மெண்ட் செக்டாரில், அதாவது இந்திய அளவில் எந்த ஒரு அரசு மருத்துவமனையிலும் இந்த TAVI ப்ரொசீஜரை பண்ணாத நிலையில் ஃபஸ்ட் டைம் கண்ட்ரியிலேயே நம்முடைய ஓமாந்தூர் மல்டி சூப்பர் ஸ்பெஷாலிட்டியில் ஒரு புவரஸ்ட் புவருக்கு டாக்டர் கோபால முருகன் வந்து கவர்மெண்ட்டோடு அசோசியேட் பண்ணி இந்த TAVI ப்ரோக்ராமை, ஏன்னா கத்தியின்றி ரத்தமின்றி யுத்தம் என்று வருகின்ற மாதிரி ஓப்பன் ஹார்ட் சர்ஜரியை இல்லாமல் த்ரூ ஃபிமரல் வெயினில் வந்து இந்த ப்ரொசீஜர் அவர் பண்ணார். அதுக்கு நம்ம கவர்மெண்ட் அசோசியேட் பண்ணோம். ஸோ அந்தளவுக்கு வி கிவன் இம்பார்ட்டன்ஸ். ஸோ டெஃபினட்டாக இந்த மாதிரியான விஷயங்கள் வந்து நம்மளுடைய சுகாதாரத்துறையினுடைய ஏற்கனவே இருக்கக்கூடிய ஒரு அந்த வைர கிரீடத்தில் மேலும் ஒரு அந்த மணிமகுடத்தில் ஒரு வைரக்கெல்லாம் இந்த விஷயங்கள் இருக்கும். இன்னும் வந்து இட் ஹேஸ் டு பி ரீச் poorest poor also. Definitely government will also support through CMHS, Chief Minister Comprehensive Health Insurance. Once again, my wholehearted appreciation to Dr. Gopala Murugan, Dr. Aravind, and to the entire team. Thank you. Thank you to one and all.
Thank you so much sir. இந்த ஒரே ஒரு விஷயம் மட்டும் நான் சொல்லி ஆகணும் உங்ககிட்ட. இந்த ஈவென்ட் பிளான் வந்து ஒரு 2-3 மாசமா நடந்துட்டு இருக்கு. ரெண்டு விஷயம் தான் எங்களுக்கு ஷுவரா நிச்சயமா தெரியும். ஆக்சுவலி வென்யூ எது, எந்த டாக்டர்ஸ் பார்ட்டிசிபேட் பண்ண போறாங்க, கின்னஸ் வேர்ல்ட் ரெக்கார்ட் கிடைக்குமா இல்லையா, இது எந்த விஷயமும் எங்களுக்கு தெரியாது. ஆனால் வேர்ல்ட் ஹார்ட் டே அதுவுமா இந்த நிகழ்ச்சி நடத்தணும்னு வந்து ரொம்ப ஷுவராக இருந்தார். ரெண்டாவது விஷயம் என்னன்னா, டாக்டர் விஜய் பாஸ்கர் 100% தன்னோட சப்போர்ட் எங்களுக்கு தருவார். இந்த நிகழ்ச்சிக்கு நிச்சயமாக வருவார். அந்த விஷயம் மட்டும் ரொம்ப ஷுவராக இருந்தார். ஸோ தேங்க்யூ ஸோ மச் for the amazing support that you've given us. So big round of applause for this wonderful gentleman. I'm going to request everybody to kindly be seated. Photographers mattum varatum, mattavanga ellarum ukkandirunga. Nigalchi innum mudiyala. We still have the Q&A session. So requesting all of you all to kindly remain seated just for a few more minutes. We have Dr. Prashant Vaidyanath with us, who's currently giving out video bites. He is the Director of Cardiac Sciences, Kauvery Medical Center.
I hope this is not live though. It'll be really dumb if this is live. It's okay. I think we can just. It's only a placeholder right now. What is on YouTube live right now? Oh, then please turn it off. I mean, there's no point us having this on YouTube. Guinness World Record screen போட்டுருங்க.